until the next meeting? I don't know that I'll make it.
No, that's what my boss I would be available for the night. Maybe a conference call at 9 o'clock. 3 days a week.
You're gonna want one. Would you give Kirk a hand up? Saved you a FOIA answer.
Thank you.
You're welcome. Oh, gosh, free in the full house. Excuse me.
Looks like there's another chair down here, another couple of chairs over this way.
I know what you mean.
Agenda. Did you make a copy of the agenda at all? Yeah, we have. No problem.
Thank you.
One more minute. You have a quorum? 6, 7, 9?
Oh, no, that's, yes.
Okay, I think we'll go ahead and call the meeting to order. I'm going to start a little something different. Meetings going forward, and that is to have a pledge of allegiance. So everybody will stand and raise the flag. We'll just recite that. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. After the roll call this morning, Dr. Graham.
Here.
Dr. Shake.
Yes.
Dr. Rico. Yes. Allison is absent. Lisa.
Yes.
Scott. Here. Anita's absent, and Kathy is absent. So 6, 7, so 4 is made. Acknowledge that Bruce is here with us this morning. Public comment. Anybody has anything? Herb?
Yes, sir. I just have a couple things. In regards to the pledge, I appreciate you saying that, everybody. I would ask you to remember the last 3 words. Anybody remember what those last 3 words are? Justice for all. That includes the taxpayers. And I think the taxpayers deserve some justice in recovering of funds that were provided outside of legal authority. The other thing, Ms. Ellis, if you could take this back to the county board, and I don't know, Bruce, I'm sure you can opine on this because we've seen this in other counties. Your accountant, I have not found any findings of potential fraud for timekeeping records. I don't know what the policies are, but a lot of timekeeping records have one signature. A lot of them just have a blanket 7.5 hours, doesn't say what hours are actually worked. Those are timekeeping deficiencies that are a potential for fraud, and I would hope your next auditor pays some more attention to that, because that's a huge finding that we found in Shelby County, if you do recall, Bruce. That's all I have, thank you.
Anyone else? Okay.
There's somebody in the doorway, do we have another chair?
Yeah.
There's one other chair.
Just here, listen. You can come in. That's the problem.
All right. First action is to, I'll entertain a motion to approve minutes for the adjourned September 21st, 22 meeting. Then we'll take them separately, so do I have a motion?
I'll make a motion.
Okay, Scott, second.
Second.
Second, Rico. Any discussion? If not, I'll ask for the question. All in favor for approval, say aye.
Aye.
Opposed? Okay. Those minutes are approved. Next, approval of the October 7th meeting. Same thing. Have a motion for approval.
So moved.
Jason, second.
Second.
Rico. All in favor?
Aye.
Opposed? Okay, they are passed. Over the cash flow, Monty?
Yes. So, on expenses, everything is pretty well in budget. You will notice the line item building improvements is over budget. We did talk about that at the last meeting, and that's the front door is now complete and the shed is now complete. And then the line item for advertising, again, we've talked about that at other meetings. That's our advertising for a dentist. That causes that to be over. So I explained the extra in SmartWatt. As you can see, that's lower again this month. So that will lower until it's at 0 at the end of the year. And then moving on to revenues, the state is behind on reimbursements for all grants, so that is a struggle at the moment. We will see that the dental group is out in schools again, so we should see some dental reimbursements rolling in this month.
Okay. Any questions? Monty?
Yeah, question on SmartWatt. We talked about this at our county board meeting. What's the status? Have you talked to Andy Patrick, or have you talked to the folks that do your SmartWatt work?
They contacted me last month, and they came in and looked at things, and they have given, actually it's the company that works on it, Sycamore, have given us some thoughts on how to make things better. So I'll need to bring that before the board.
Okay, so mechanical ways to make it better? Okay. All right. I'll share that with Andy.
Okay.
So far, it's a little bit more, it's still efficient from what it needs to be.
Yeah, we had someone covering up with a blanket in their office, so.
Okay.
Yeah, it's just got to be fixed
Yeah.
to the extent that it can.
Yes.
Okay. Any other questions? No, I'll take a motion for approval of cash flow.
I know.
Doctor, second?
If we're still having I'm still trying to figure this out. If we're still trying to figure out what the salaries are, can we approve this the way it is?
It's actually.
I don't know.
It's just a cash flow report, man.
Yeah, it's
Okay, I just want to make sure.
nothing to do with the
Yeah.
budget per se.
It's your P&L statement.
Okay, copy that.
Okay. So, all in favor? Aye. Opposed? Okay, passed. All right, Monica, have you got any report?
I do. First of all, I have had the opportunity to sit down with Bruce, and he did make some suggestions on how we could improve some processes, and one of the things he recommended was to have an employee come in and take our minutes, so that someone who is trying to participate in the meeting is not trying to take the minutes. So that's what Marissa is doing here. Thank you for agreeing to that, Marissa. An update on our WIC and family case management. WIC is returning to in-person appointments while maintaining the option for virtual appointments as required by the state. The in-person appointments are requiring extra care for local children who have had lack of access to appropriate socialization and medical care during the pandemic. Appointments include their screenings for motor development, socio-emotional development, perinatal depression, lead screening, and hemoglobin tests. Our WIC staff has gone above and beyond the call of duty in trying to help families adversely affected by the formula shortage. I stand amazed at what they have done. They've worked closely with the state and with Catholic Charities to locate and distribute formula to families in critical need. Since August, our WIC team has secured a total of 346 cans of formula, which has been distributed to 50 local families. There is a process for that distribution. They can't pick and choose. They have to work with the state when a family contacts us. So additionally, our WIC and family case management team provide medical case management services to 38 Edgar County children up to age 6 who are in foster care. And our clinicians also provide quarterly physical assessments and follow-up guidance and coordination of care for infants, 22 infants up to age 2 who have birth defects and other at-risk issues noted at birth. Those infants are referred to us by the delivering hospital. We have seen a significant increase in the number of children that are in foster care that we are working with, as well as at-risk infants since the pandemic. Our CD department has, in the last 2 months, done 36 lead screens. Our flu and COVID vaccines, staff has contacted all our long-term care facilities to offer flu vaccines and COVID vaccines. We have visited some of those clinics, and we have others on our schedule to visit. They have, in the last couple of months, participated in 3 community events and obviously are giving vaccines in office. We've given 334 flu vaccines, 15 Moderna primary vaccines, and 239 bivalent boosters in a variety of locations. We have now 2 additional staff who are certified car seat technicians, which was a great need for the department. And we didn't have a car seat event in the last couple of months, but we have distributed 6 seats. In dental, the hygienist assistants and support and billing staff are extremely busy with school preventive program. They've completed services in 6 schools since the last part of September, so they are out. The staff responsibilities include preparing school paperwork, eligibility verification, assembling take-home bags and information, entering student information into dental software, service delivery, charting notes, dentist exam, and billing, and then case management services. We are still waiting for Dr. Graham's credentialing to come through. A never-ending process, but we're still working on that. Dr. Llewellyn has been helping with exams to this point. Our dentist recruitment continues. Our COVID programs for MassVac, we're carrying Moderna and Moderna bivalent booster, which is now available to adults and children 6 to 17. So that was just recently passed, that we are able to provide the bivalent booster to children 6 to Providing vaccines and boosters we're providing vaccines and boosters at community events, offering vaccines and boosters daily on a walk-in basis, and we're continuing to distribute and maintain current information about vaccines, bivalent booster, promoting booster to schools. We're offering the booster to area businesses, and other off-site vaccine booster clinics are planned. Our COVID response, our hotlines continue to be maintained so community members have quick access to answer questions about COVID and vaccines. COVID response team continues to work closely with long-term care facilities, the state, and other congregate care facilities as needed. At this time, we do not have any facilities in outbreak, which is wonderful because we were struggling with that not so long ago. Our staff continues to monitor the transmission levels and number of cases in our county. Our environmental department has completed routine inspections. The website is updated by them. They have launched a mosquito testing program under the West Nile grant, drafted the mobile food ordinance that's been approved by you and now needs to go to the county board. They're planning a countywide exercise to prepare for future public health threats or disasters. The emergency planning department they updated the fire safety plan, completed the fire safety training and a drill. They've revised our emergency evacuation maps, a revision of volunteer management plan for our public health emergency preparedness, and they're working with ESDA on a training exercise, and then our coordinator has completed NIMS training and FEMA training. And then for our health education, we've been partnering with schools to prevent tobacco prevention and cessation programs, created a video and quiz for students who get suspended for vaping use. So if they are suspended, the school requires them to watch the video and take the quiz. And Paris and Shiloh have requested that video and plan to implement that program. We are offering it to all of our schools. And then we did a health fair at Aerogentech, offering flu vaccines, oral cancer screenings, COVID information, health information, tobacco cessation information. And we've participated in community events. So, try to talk fast. I know you have a lot of things to do.
Okay. Any questions, Monica?
Monica, I just want to ask about with regard to recruiting activities for locating new dentists. Has there been any other recommendations from the recruiter about, I know at one time we talked about participating in job fairs or whatever. The last I knew, we were going to 2 dental schools in the state.
Right. And I haven't been to a job fair. I missed them. We're recruiting on site, and I participated in one that was virtual, which was not successful. So it would obviously be much better to go in person and participate, but there has not been a lot of availability for that. I did talk to Ollie about maybe working with the hospital's recruiter to see if we can get some help there. We have national ads out. I just purchased a spot with HRSA for an ad. We've got ads out with all the schools, so.
Recruiting in general has been difficult in the age of COVID and Zoom.
Yes.
And I would agree with, if we have an opportunity to go to one of the schools, that would make a lot of sense. It's just easier if you can make a connection, face to face.
It's been a process this time. We're not.
Yes, it has.
It's different. I think maybe you can address this a little, Jason, but it seems to me it's not a lot different than years ago for pharmacists when they were coming out of school. Chains were hiring a lot of the graduates. I think the same thing's happening now in the dental world, where the chain dental companies around. Corporate, and they pick them up right away out of school. It eliminates a lot of the students that were looking for grants and things like that. And then they work them to death, and who knows what they'll do later, but they passed that part where you're not looking for government support. And I don't know whether we need to look more at the rear end of careers versus the beginning. We did that originally years ago. Some dentists were looking for a slower way of life, maybe looked at that more seriously. I don't know whether we can find anything like that either. There's just a
It's a
big
hard
shortage.
population to recruit towards.
Yeah.
Where do you find retiring dentists?
That's true.
You know, the new graduates come out of dental school.
Yeah.
That's going to be more successful in the spring of the year, though. I mean, they're not even going to be thinking about that now, and they won't until about March or April.
Is
So
there
I
less
was-
people now going to dental school?
No, it's the same.
Is it about the same?
Yeah. So there's a few schools that have closed throughout the country, but still it's about the same number of people. But Ollie's right, the corporate dentistry has changed everything for new graduates.
Yeah. It's competition, and
Yeah,
for us, not so good. It's,
Right.
It's hard to recruit to public health
yeah.
department. It just is. So we'll keep working on. Hopefully, maybe we'll get some movement on our end. I mean, a lot of recruiters hear about or know about this. We just need a lead. We don't really need them to actively recruit. We just need some names.
Right.
Nothing else, and then we can do the rest. So, all right. Next, I think everybody has gotten the letter of agreement for Bellwether. Bruce, do you want to just address this a little bit? What it means, what it doesn't mean, and go give an explanation.
Sure, happy to. So, for those who haven't bumped into us before, Bellwether is an operations management firm. We've served 81 out of 102 counties. We do budget and finance and HR and dust busting. So we were contacted by initially the chairman of the county board, and then referred to the health department on kind of issues that have come to light. The desire was to move as quickly as we could, so we, and I own the company, decided that we would take the first 10 days at risk and got started right away. So what you have in front of you is a letter of agreement, which is essentially our contract for this project. If you don't approve it, that's what risk is all about. I'll move on. You won't get any more work from us, but you'll get the first report and we'll move on. When we get into the report, I'm going to move pretty quickly, as is my style, and I really rely on people to ask questions. So the first step is the agreement, and like I said, we decided to go work at risk. So it's up to you now. I can answer questions about the company. I'm a Paris native, a class of 78, and went into the military for 21 years, and became a serial entrepreneur and started and bought several companies, and now retiring. That's my RV out there. I'm headed to Texas. So we just either approve and we continue, or don't approve and I'll go get in my RV and go to Texas.
But to clarify also, you have Dustin that I've spoken with.
Right, so we do have a retainer, a small retainer with the county for virtual HR support, which is essentially answering questions. We do provide some draft counseling sheets when employees are needed a little bit more guidance, but it's a pretty superficial retainer that didn't include anything with this bill.
Well, I could say we had the privilege of meeting with Bruce a little bit about our issues and how we're going about fixing. He's well versed. He's got we're glad we have him to help us get through our issues that we found to be deficient. And So I would recommend a motion to approve this agreement.
I'll make a motion.
Okay, second?
I'll second.
Okay. Any more discussion from anybody? Do you have questions about it? Because, I mean, this is a significant amount of money for our board, and, but I think it's important that we get it corrected, and move in the right direction, so, it's been moved and seconded, no discussion, I'll ask for the vote, all in favor?
Aye.
Opposed? Bruce, looks like you're with us.
She'll wait. She doesn't drive it, so she'll wait for me.
And I think with that, we're going to move into the salary issue. So do you want to start your discussion?
So you have in front of you a multi-page report, and there were a list of questions actually summarized at the end of the last meeting. So since that time, we've requested volumes of information from financial reports, minutes, interviewed Monica, Janet, and the chairman, met with Lisa, and very quickly gathered enough information to kind of sort out the topic. So I want to start with just a couple of overviews that will make it a lot easier to move forward. There are events in medicine and in business, heralding events that cause change. So if I went to 10 health departments, I would find 8 of them that are very good at delivering community health and are not so good at administrative process and little things that are necessary and should be done. But like the administrator's report just done, there's a lot of good work that they're focusing on. They don't focus on that. I said to Kirk this morning that I was in one of his videos a couple of months ago, and that was my heralding moment. When I looked at that video, I went, I'm an old fat man and I need to do something different. So I went and saw my physician, I went and saw a workout. So that was my heralding moment that I had to make a turn. That's how we see the events that are going on in the health department, and that's how we see the moment that we're at. I think that the health department should consider, and it has in the administrative, there are a wealth of process issues in time card, in documentation, in board procedures, there's a wealth of them, but you can't unring a bell. So things that have happened, we need to acknowledge them, and then we're going to take some corrective actions. And I'm going to talk more about the corrective actions kind of at the end of this. But there were a list of questions. That's what I'm going to focus on first. That's what we spent the first 10 days working on. There's another question that we'll work on for another month, and then I'll have somebody back here next month to give you the answers on that. So if you have this document in front of you, I'm going to speak to it. I know that many of you have got time pressure, so I'll move quickly, but please interrupt, and I can give you my contact information. If you've got questions later on, we can certainly discuss this more. So I want to call your attention just to page 2 and 3, where we listed the scope of the effort. And these, again, were summarized in the last meeting. And it really gets down to what was the process used to determine compensation for the administrator and the assistant administrator. What was the second one is what was the appropriate compensation level? What is the appropriate compensation level for them now? The third one, what's the impact of those decisions on the pension obligation for the county? And then the fourth one are, have all of the board's processes followed statute and guidelines? So examples are, you have minutes or you have actions where people dialed in or came in by Zoom meeting. During the pandemic, there was a blanket policy from the governor that allowed that. Absent that pandemic, you actually have to have your own policy, a stated policy to do that. So can you do it going forward? Absolutely, you can do it going forward. We'll provide you with a template resolution that will give you the guidelines on how to do it. but you have to have that guideline unless you're in the height. Now, I just heard, I don't know if Illinois has declared the end of the pandemic, so it's very murky to me how all of the executive orders either are in effect or aren't in effect. But in the absence of that, we'll get a resolution to you and you can make your own rules. The fourth one is the one we'll come back to in a month, and what we've requested is 4 years, 3 years worth of attendance, board attendance, and minutes. And we'll go back through all of those, and any action item that you took where you didn't have a quorum or there wasn't a proper notice of the meeting, then we'll go through probably a couple of months of remediating all of those. So if the board took an action and there wasn't a quorum, that action has to be revisited and voted on again. Even though that may be a done deal, the public has the right to the conversation, the public has the right to the information, and then the board can take an action. Now again, we can't unring a bell, so if it was, we needed to buy a photocopier and we bought a photocopier, but you made that decision at a board meeting where there wasn't a quorum, it'll just be an administrative process. First thing, the next thing is there is at least 2 items of confusion that took us a while to unravel. The first is the transition of the administrator and the assistant administrator from exempt to, or from non-exempt to exempt status. So I've included the Department of Labor Standards definition of those 2. And in a nutshell, if you think about administrators, much like yourself, professional people whose jobs don't fit cleanly into an 8-hour day, they may fit longer, they may fit shorter, it may happen on a weekend, it may happen in the evening, but you're paid a salary. So in discussions with the county several months ago, we looked at kind of the blanket approach to other department heads or other employees where that position is better than an hourly position. When you get to, and we deal with this in other counties, when you get to the top of the department pyramid, who signs the boss's time card? So quite often, and we were just in a county last month where the boss's time card was signed by the assistant and the assistant's time card was signed by the boss, which isn't a good checks and balance, but if you become exempt, that becomes irrelevant. So that confused the issue. The second thing that confused the issue is kind of the swapping of the chairs. So what was once isn't, and there's something new, and the dates that those happened are kind of relevant. So on page 4, and I promise you I'm going to move pretty quickly. On page 4, the first thing we had to do is to try and define some baselines. So at the top of that page is the line chart. And previous to 2021, there's more copies here. Prior to 2021, the county stayed on a pretty regular 3% rate increase annually. And they stayed on track for that pretty much ongoing. When the pandemic happened, so you get 20, 21, 22, and we went to the temporary pay. When the temporary pay was put in place, there was no way to reconcile to what do we do when temporary is over. So we took that trend of 3% and just projected it out over the next 2 years. So the top chart there on page 4 really just shows what the trend line of the 2 positions compensation would be if they continued that 3% trend, which has been a pretty solid trend for the county. Now, the bottom of that page, you'll see a very drastic indication of what the public health emergency created. So these are a documentation of the number of hours worked by these 2 employees. Prior to August of 2020, overtime was relatively unheard of. I mean, we went back 2 years and it was just not an issue. And then you can see the spike, and then you can see the variation. So as non-exempt employees, both the employees were collecting overtime based off of time and a half of their base pay. Remember, they're hourly still. So at the top of page 5, you'll see what the impact of that has been. So on the left is the bar chart that shows the dollar value of the overtime that was paid in those 2 years. So the base that they were paid plus that number in those bar charts. That's the impact of non-exempt employees. Now to the right of that, you'll see a multi-line chart, and it shows the contrast between the trended at 3%, and in this chart it's called normalized. So the trended at 3% compared to the actual, which is their base plus their overtime. So during that period, their total compensation increased significantly on a basis of overtime. The problem is that you now have employees who, by their definition and by the state's definition, are better served as being exempt employees in a crisis situation driving an overtime clock. So a decision was made at the county's recommendation, the board's recommendation, well, let's make them exempt, let's make them salary. The problem is that when they were made salary at that moment, they were made salary, or the director was made salary at their prior base. So you go from total compensation of $109,000, which took into account all of the overtime, and moved them to exempt, drops back down, and I think the number was 74,000, I think was the base. But the point is, you took overtime away. Now, if it had stopped there, if you had a more confrontational relationship with your administrator, in the state and federal fair labor standards, that's considered time card manipulation by the employer. So you manipulate them from a class, from non-exempt to exempt, in order to avoid overtime. So in that instance, if it was a confrontational employee, they had cause. And that's not the case. It plodded on until February when the chairman recognized the inherent unfairness of it. And this is where I have a lot of caveats in the language here that says, notwithstanding process errors. So do I understand the rationale of you went from base plus overtime back to salary, inherently unfair given the number of hours that were being worked, and then a local decision was made. Again, can't unring the bell. It happened. We documented it. So in the initial part, the compensation changed, and then in February, they increased the administrator's role based on an estimate of total labor hours. So they kind of adjusted the base to include this temporary overtime. Now, process. Could it have been defined better? Yes. Could the math have been used better? Could they have dug deeper into the time cards? Yes, all of those things are true. Process could have been better. The intent was pretty solid. And I'll show you that the numbers weren't that far off. And actually, in one of them it's slightly high, one of them it's slightly low. So, page 5, top of the page 5, you can see the value of the overtime. You can see the difference between the extrapolated 3% and their actual. We went back and we do ARPA management for 51 counties, and we did cures and cares management for a couple of dozen counties when that program was going on. We went back through all those programs, reviewed the guidelines for the uses of those dollars for compensation. Both instances are true. So the use of those funds to pay overtime for primary involved employees, allowed. For exempt, allowed. For special compensation during the pandemic, all of those were allowed. So we found no violation of any of the guidelines from the programs that provided federal and state funds. So there's no issue on how the dollars were used. So on page 6 is actually a lot of excerpts from published federal and state FAQs on the topic. So I won't read it to you, but there's a lot of different titles for this temporary pay. Some have called it premium pay when it was early in the program. It's been called COVID pay, it's been called hazard pay. Essentially, it's compensation addressing the number of additional hours. So, next question then is, what's the impact on the status change? So we'll start with the then administrator, Janet, and if you look at the top of page 7, then you can see to the left, again, the demonstration of the number of overtime hours, and again, process. There were apparent documentations where the number would flatten out and then it would spike up. So we see that typically in catch-up. I didn't report all of my overtime last pay period. I'll report it this pay period and it'll spike up. To Kirk's point earlier, a double-signed pay timesheet or a double-signed accountability takes care of those kinds of things. Is it messy? Yes. Is it processed? Yes. But it's there. So to the right, again, is the first time we see the contrast to the temporary increase. So on the left of the bar chart, you see 2020 total overtime value 32,000, 2021 total overtime 19,000, and then the temporary increase from the base. Now remember, this was from the base of 2021, so it's an old base to begin with. But the difference between the base to the temporary, 29,850, and when we looked at the trend for overtime, the trend in both positions were running about 33.4 hours per pay period. It looked like it was trending down, and one of my analysts actually thought that there was a annual cyclic value in 21, 22 that they thought. That, so if you think about it, the media talks about the winter surge. So there is some demonstration of relationship between hours worked and the surge effect of COVID. So although the trend looked like it was 33, it looked like it was trending down shortly towards the end before they were made exempt. But I have 3 analysts that worked on this, and one of them had a minority report that thought it would have gone back up in the fall. So you can see that the 29 for the director at that time, the 29,000 has parity to the overtime, and the rationale of it makes sense. So let's look over at page 8, where we're going to get to the same question for the assistant administrator. And you can see exactly the same thing. Now there's some vacation times in there that gives you the inverse lines on the left. But the same question is 2020, you have a total overtime value of 37,000. 21, it was slightly lower. And then the total increase for the temporary wage, 27,000 and change. So again, the amount of the temporary increase has parity to the overtime trend, notwithstanding process. Now, I'll concede process could have been better and can be cleaned up. But our question was the rationale and the assigned dollar amount, did it make sense? Our conclusion, you can see at the bottom of page 8, is given all factors, it appears that the rationale met the trend and that we didn't find any ill intent, if you will. So the question that the board ended on last time was, all right, so if the temporary pay is over, how much should their pay be now? This really was complicated by the musical chairs. So we took this approach, and we're going to ask the question after this presentation. We took this approach of the trend of prior salaries being related to the position, not the person. Now, that's a pretty broad sentence when you look at the assistant. The administrators, we could get a lot of sample data from other counties to be able to do some comparisons. But the assistant administrator comes in many, many different titles. They are CFOs, they're grant writers, there's all kinds of different things that they're called, and their compensation vary pretty widely. So we have an opinion that I'll get to in a moment, but at the same time, we're also doing a desk audit on the administrator, the assistant administrator's duties, and then next month we'll respond to that desk audit and say, so these are the duties. Now, looking from a mile away, most of those duties are related to grants and finance. So the prevailing salaries for grant writers, if you're in that business at all, is pretty good. Grant writers make money. So now it got to be how much is a reasonable expectation for a local government the size of Edgar County. So again, looking at page 9, that chart is the one that you saw earlier. That's the 3% trend. The assistant position had 2 pay periods where it increased more than the 3%, but it looked like when you went back into the financials, it looked like that was a point of changing a role. I believe Monica came from another part of the department and came into that position, so there was an adjustment on a position change. But that's the trend, and that's our assumption. If you do not believe, we're going to call the question, if you do not believe that the salary is related to the position, then we've got more work to do. But let's look at page 10. So at the top of page 10 are 2 data charts. So this just puts into numbers the charts before of if you extrapolate 3% and make some assumptions, even after they became exempt employees, this would be their salaries. We then sampled very quickly. We had some references from the health department, we got some references from the county personnel committee, and then we had an analyst that dialed 14 counties, and it was Edgar County and 7 counties in population above and 7 counties population below. So we bracketed the county and called as many as we could. The information that they gave actually is a little muddy because we couldn't absolutely put our finger on is that a 2021 number or a 2022 number on some of their responses. But if you look at the run chart at the bottom of page 10, you can see that the compensation varies widely, and the larger ones, not surprisingly, are from the larger counties. There's a couple of smaller counties that have some pretty good compensation, and I can't address how or why they do that. Health departments are unique for counties. They address their needs, so if they have a special need, then they pay more. There's also the factor of if you're trying to recruit a professional administrator to work in McLeansboro, Illinois, you may have to pay a premium to get somebody to move there. So it isn't always proportional, but we used population as our straight edge. So the red line going across is the 2022 assumed 3% increase of 82,000 and change. And if you look at the bottom on the conclusion, that 82,000 and change, that's 88% of the sampled county's median. So now you get into, and you'll have to make this judgment call, and it's on the agenda here next. Do you stay where you're at on the 3% trend, or somewhere between where you're at on a 3% trend and the median is what somebody who runs a business would look at? You can always establish a pay now and next year do another deeper review and make a decision if you feel like there's a decision to be made. My interpretation was we needed to do something that we could hang our hat on. I think this is good math. I think my people did a good job of chasing this number into a corner. So you're 88% of the median right now. The administrator, the assistant administrator, like I said, is a variable, county by county on the roll, but it has trended out to be about 85% of the administrator's compensation. Is that a good number? You'll have to make that decision, but again, you can make that decision. It's not a tattoo. You can make that decision and make a decision again next year. So one of the interesting questions, so the nice thing about owning companies is that I get to hire smart people, and then they give me stuff like this, and I get to look smart. So IMRF is a maze, not amazing, it's a maze of rules and tables and charts, and it really is very interesting on how this unfolds. But the nutshell is, when you go to retire, they look at the last 10 years of your service, and they take the highest 48 months anywhere in that 10 years. So that's pretty much what you can hang your hat on. The chart on the right, and it says not actual only because there's 2 or 3 more formula steps, but this is pretty much approximated to the reality. So the red box shows what the 48 months would look like, including their temporary pay and overtime. So the 48 months would have a total compensation of $391,000 and change. But if you extrapolate out the 3% increase and they work out a few more years, the incremental increases at 3% actually make their last 48 months higher than the 48 months they're in right now. So is there an impact to the taxpayers' pension funding? The answer is no, and we can demonstrate that 2 ways. First, by this projection. Second, IMRF, when you exit 125% of the lifetime value, requires an accelerated payment from the county and from the employee. That we checked with the treasurer, we've checked with IMRF, there's been no request for an accelerated payment, which means that IMRF didn't see. There used to be an old game within the last year, people would get a big pay raise of 3 times their pay, and then that influenced everything. These are the rules that caused that to stop. Technically, I don't think it stopped, it just made it a different game. So the answer is, you had the overtime payment, which was due and appropriate by both the federal and Illinois Fair Labor Standards. Change that over to the exempt payroll, extrapolate out the 3% increase. The dollars that are likely to influence their pension are towards the end of their tenure, not in the immediate time frame. So our opinion on that one is that the temporary, while it increased the hill in the middle of their career, likely will not impact their pension after retirement. Okay, so the last one is probably the one that will be most onerous to the members. So 3 years worth of meeting minutes, 3 years worth of attendance and how you attended and the actions taken. And we're going to go back through every one of those and then come back with probably a shopping list of topics that you'll have to chew through. Now, as I looked at the board, you don't have hours to spend on this, so you'll probably have to chop these up into a few a month, and it may take you a few months to make it through this. But like I said, you can't unring the bell, but the public has a right to the knowledge and to the discussion. So we'll provide draft resolutions for your board to work through over a period of time. There are a plethora of process things that need to change. It is our practice, and Kurt, you've heard me say this a number of times, we do not propose engagements during diagnosis. You probably need somebody to guide care visits. You need somebody to guide them on how to get time cards set up, how to get PTO management. And the administrative part is, in my opinion, short-term as it is, you have good people who are focused on good works of healthcare who probably aren't great at county accounting, but could be. I mean, it's not rocket science. I mean, it's process, and it's mundane and it's arduous. And when you're thinking about a pandemic, you don't think about process, and then you get to the kind of world. So that was pretty quick, but our conclusions are in writing there. I believe we have on the agenda for call the question, so I would bring you back to page 10, and the hard part about leadership is making decisions. And then, honestly, it's going to be a pain in the ass for a few months as we revisit all of these decisions you've made for the last year. And if any of you are proctologists, then you're all right.
Once again, I know it's difficult to discuss salaries with the employees in the room, so I want you to feel free to discuss. I know.
I saw you do that on video, but here's the interesting thing. It's kind of like when they were discussing whether or not to hire us. It's a public meeting, minutes are being taken, and it's on video. So whether you're sitting there or you're watching it on video, it's a public meeting. If you're not the administrator, you're still at least a member of the public. If you are uncomfortable and you want to excuse yourself,
I am uncomfortable.
that's entirely up, but there's... Okay. Mr. Chairman, I'll leave you with this. When we looked at timesheets and we looked at record keeping and we looked at minutes and we looked at kind of the documentation, there's probably a year's worth of process redesign to be done. So, and there may be people locally who can help you. I wouldn't hire somebody full-time to do it, but it's, you need a good process person. And if you've got a process person, then, at the hospital or however or wherever, but that's what you need, is a good process.
Can I add to that?
Yep.
Okay, so for those of you who don't know about the details on this, I had assumed the hospital had made the recommendation of ADP because that's what you use. Yes. But Monica had shared that through grant opportunity, they had contracted with ADP for their timekeeping and HR process. But when I talked to her last, she said they had not gotten it set up yet. Do you know the status on that? Marissa, do you know?
It was set up.
It is set up. That can take a lot of this load off once they're trained and they know how to use it. Sure. The county, in the meantime, because we were not in communication on something like this, we are in the process of setting up Paycom for the very same purpose. So at some point, I would hope that when their contract with ADP ends, that they will come with us to Paycom. And Paycom can take, with training, everything requires training, but that will standardize a lot of this issue. However, a time card still has to be filled out appropriately, whether it's online or on paper, and it still needs to go through the appropriate process for approval. So that's my 2 cents, that this should get better and it should get easier and more official and appropriate. That was it.
We provided a draft resolution on public comment. I saw that in the last minutes also. We'll provide another draft resolution on how to attend virtually. And So we've got a lot of things in the toolkit that we'll just provide to you.
I got a question.
So let me stop you. I can answer your question if it's okay with the chairman. Okay, go ahead, sir.
I'm not sure why we're not just punching the time clock. I mean, it stamps it.
For a non-exempt employee, so there's all kinds of biometric time cards, and I don't know about the payroll system, but there's all kinds of time cards, yeah.
My wife's the boss at iBuy.
Yeah,
As soon as they touch their card,
yeah,
you know.
yeah, there's, you know,
Even my employees, as small as my business is,
yeah,
they come in, they punch their card.
yeah.
That's
Yeah,
just
there's-
a standard.
It's easy to do time cards. You just have to acknowledge that that's important enough to focus on. Yeah, sir.
My question is more for Lisa probably than you, but either one you can answer it. Is all county employees get a 3% increase every year?
The county board allocates based upon what we feel like we can afford as a county and a taxpayer and a tax receiving body. We allocate a percentage or a portion to each department or each elected official. In this case, it would be department. And how they spend those funds is determined by them. The health department is a little different because it's not really a very large amount of county money that makes up their total budget because of so many grants and state required programs.
So what you're telling me is some county employees don't get an automatic 3% increase every year.
I wouldn't say automatic is
Not
the right
automatic.
word to begin with. So any county employee who's involved in a bargaining unit is subject to whatever that contract exists. Many counties will then mirror their non-union employees to whatever their union rate is.
But, and I've only been on the county board a couple of years, but if times are bad, there are no increases.
But the IMRF line says 3% every year.
Trended looking backwards. So if we look backwards, then the trend for the county was 3%, and then we extrapolated out.
My question again is, do all county employees get a 3% increase?
I think that's what was in your budget for the last 2 years.
For the last 2 years. But I get what you're saying. If a county employee gets no increases, their IMRF still 3%.
Their IMRF contribution is not 3% if they don't get a 3% increase in their wage.
No, and it depends on what tier they're in also for IMRF, and it depends on where they're at in their career rate. So if you're under 10 years and your contribution, the formulas are maddening, but if you're under 10 years for IMRF, the employee and employer contributions are different. If you're tier 2 when you're in your second 10 years, so I've never successfully matched compensation plans to the IMRF impact. The IMRF impact every year, the county will get a statement from IMRF. It's a fully funded pension program. So they're going to send a notice saying what your obligation is under GASP for fully funding your pension. And the only recourse is if IMRS feels like you haven't funded to the GASP level, then you actually get a negative impact on the county rating overall. But I've never successfully matched the two. I can tell you that 3%, and you're just entering negotiations on Sheriff's Department, right? So Shelby County, which is one of our counties, is wrestling with the FOP wanting 6, 7, 8% increases because of the inflationary impact. And so right now, the inflationary impact of compensation plan through everything out the window. And the hard part is county employees, especially deputies and jailers, don't make a lot of money to begin with, and inflation sucks it out of them pretty quickly. But there's a finite amount in order to increase 6 or 8% to counter inflation. you have to levy differently. So now you gotta levy people's taxes higher to counter inflation when they're dealing with inflation. That's the leadership chore.
Thank you.
Yeah. Sir?
Okay, Harry.
I'm done with the presentation part. I think is your next part the...
Send this out.
So again, we provided information on where you stand on a comparative group. If you're setting a salary now, and then in the middle of a fiscal year, not in the middle, tail end of a fiscal year, then you need to also decide if you're setting the salary and it'll remain static after the start of the fiscal year. So this is October, and if you go to the 3% increase, let's just say that for 2023, for the administrator, you go to the 84,000 and change. Does that 84,000 and change start today, tomorrow, November 1st, December 1st? Because you're going to cross a fiscal year, so you've got to keep that in mind also. I think 88% of the median is a pretty good start. It is, I think you said at the last meeting, when you start giving people money and take it away, no matter how many times you say it's temporary, it feels bad. I did spend some time with the chairman and the two employees and reiterated that this is temporary. It's unsustainable. So I think they're as much emotionally prepared. But I think 88% of the median, based off of county trend, is probably a pretty good starting point.
Bruce, I had asked you a question, but didn't give you any opportunity to answer it.
Isn't that strategic of me?
No, it was just me having that deep thought on the drive here about if you are an elected official, it doesn't matter your tenure in that position. I'll just use an elected official here that we have. You know, Don Wiseman, he's been in his position for quite some time as treasurer, but it wouldn't matter whether he was here 15 years doing a stellar job or he just came in. It's the position that gets paid, and therefore our role is to determine what that position is worth. But my question to you that you didn't have an opportunity to answer is compensation for a public health department administrator based upon the position? So it wouldn't matter if the person had been here 20 years and did a stellar job, or whether they came in yesterday. Is it based on that standard, the same as elected official, or do you start them and give them merit raises?
I don't know that tenure translates to proficiency on a reliable scale. I know a lot of people who've been really bad at their job for a really long time.
No.
So I can't make that. When I look at compensation, I look at what is it going to cost me to retain the person that I have, if that's my desire. And if I'm going to value the position, then it's not only is my pricing to retain, but is that the price I'm willing to pay to attract? So tenure and elected officials are different animals. But I do want to mention that in many counties, when you're required to establish an elected official's salary 180 days prior to the start of their term. In many counties, they use that as the exact same moment to establish all other non-elected department head salaries. So they'll say, and to your point on the treasurer, some counties have got incrementals based on the number of terms, some are incremental increases per year over the entire term. But to me, as a business owner, I price to retain, and then because attracting talent, keeping talent is a hard thing to do.
Okay, because, and the reason I bring this up is if we go back to page 4 and we take a look at the top graph, this is exactly why I asked this on what is our measuring, how are we determining? Because taking a look at the blue line, which would be the administrator, which happened to be somebody with tenure and experience, now that's not the same person. So are we justified, is it warranted to have a new administrator start at the same point that we had the previous administrator who had experience and tenure?
I'm just making sure you still have a quorum.
I'm gonna have to leave in just a few minutes too,
Yeah,
so
I would
we
say
need to
call
vote. We need
a
to
question
get to
and I
it.
can,
Yeah.
Process question. Have you looked at your budget? What is in your budget? Because I don't want you to approve something you haven't budgeted for.
Pretty sure, you've seen the budget, Lisa? I think their elevated numbers were in there at the time, because they didn't have anything else to go with the budget.
the
So
22
it
budget,
should be in there.
22 budget is sufficient. The 23 draft budget continues the temporary, but only as a absence of any other option. If you lose another member, you won't have a quorum, you won't be able to make the decision. So I would go before you lose a quorum.
But I don't want to make a bad decision out of expediency.
Okay? Okay.
I think there's a philosophical question here that has to be answered. Unless this is a decision that's only being made for 1 month, and then we have to revisit it again.
At some point, I become just the guy that does the thing, and somebody else makes decisions. But if you're pricing for position, and that was our opinion, that the competitive wage for the administrator was 88% of the median of all other administrators, which made sense to us.
So 82,000 and some change is where you looked at as where it would have been a good.
So on page 10, if I were my employee and I was making a decision, they would walk away with a 2002 number of 82 and change, with a planned 2003 number of 84 and change. The top graph on page 10.
Yes, sir.
If it were my employee and I'm making the decision, that's my decision.
As a business owner, I understand what you're saying, because it's tough enough to be able to keep people. It's even tougher to keep good ones,
Yeah.
because somebody's out there poaching every minute.
So stretch it on if you want. Make it a decision next month if you want. I'm just saying that as soon as you lose the next month, remember, you no longer have a quorum and you gotta go.
All right.
There you
They are. That has been determined.
They should have always been.
So when you base this,
Okay.
it's gonna be at 82, or, yeah, 82.
Are you okay with that stated figure for the administrator?
Yes, I would vote yes to that.
Then you need to do the vote before you leave.
Yeah,
Or I gotta go like,
Once you
we
walk
gotta
out
be
the
there
door,
at
it's done.
8:15.
so everybody knows. the
Need a
number.
motion, a second, and then a vote.
Yes.
I'll make the motion to follow the guidelines.
Okay,
for-
On page 10, at the bottom of page
Yes,
10.
correct.
80% of the.
all in favor?
That's what I would.
Aye.
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 All right.
Motion passed.
Okay, now you're gonna lose your quorum, and then you'll have to adjourn immediately. Now, you can continue to discuss non-action items, but you can't do any more action.
I gotta go.
Thanks, Ian.
Thanks, Jason.
You've got my card.
Appreciate it.
Yeah.
Okay. Appreciate everything you went through this morning for us. I think it was good to get some other people to
And we got a
understand.
question, it's 88% of what, two figures?
I'm sorry, you gotta stop. You have to adjourn.
Yes.
Yeah,
You have to adjourn. You can't continue
Coach James
on.
actually just can't.
So you need a motion to adjourn,
Motion to
a
adjourn.
second,
I got a second.
okay?
All in favor?
Aye.
These are the squirrely little things in the rules. Now you can talk about anything, including the ball scores.
Yes.
Okay.
The way I saw it is.
I don't,
You got
you don't know.
88% is the,
This and these two
of these
figures.
7 counties.
Thanks, Doc.
Is that correct?
Or is it 88% of this, 88% of that?
That's what I was thinking.
You think it's
It's
88%?
close, not this one, the other so.
Okay,
You're done.
good.
And I'll send you an adventure, that's called last night.
All right.
So instead of making 119, they should be making
Sat next to Wayne.
Yeah, I don't
That's the
disagree.
way I get it.
Still right at
It's 88% of something.
They got a year's worth of.
Represents 80% of the sample counties.
Right, 88% of the 7 counties that they went one.
But is that for the administrator and the assistant both?
Hey, it is. I mean, I know it sounds bad, but I feel that it is fair. It may not be what we like or what, maybe there's personality conflict of some way, but still for the position,
That's a fair price.
That's a fair
I mean, honestly,
yeah,
I think it's a very fair.
the 119's way out.
119 is way out. So,
I mean,
At least
I
that
can't even
got,
get them to come
at
out
least
and
that got rid
inspect
of
the
it.
septic after hours, so I don't know how they get.
Oh, God.
No, you gotta keep
There's
the
so
pay
many
there.
problems
You won't have
out
one.
there.
Yeah,
Where do
you won't.
start,
So that's
right?
just it with the dentist? You know, you're
Well,
not-
yeah, you're not gonna get a dentist to come here for $100,000.
No, because they can go.
Every